The inability of Esther to deal with surges in demand has been the subject of many warnings to the Victorian State Government, including warnings from the State Coroner's Office, the Inspector General for Emergency Management, following the 2016 thunderstorm asthma that left 10 Victorians dead in Victoria. On the 30th of April, the number of emergency calls per quarter rose, and the response times were continuing to blow out in the state, and there was no answer from the government. On the 28th of September 21, there was an article in The Age, and I quote, "Community Workers Union Secretary Sue Riley said the agency was underfunded for years before the pandemic and was not equipped to handle the heightened demand. The organisation is at the lowest point it's ever been," Ms Riley said, adding that many staff members had departed in the past 2 months due to the pressures. Ms Riley and an Esther worker said the organisation relied on staff working overtime and not having breaks. Ms Riley said workers who may have finished a traumatic call were sometimes hiding in their cars to avoid being called back to work. "Since the middle of last week, it's gotten even worse," one call taker said. "We have 16 to 20 calls waiting at a time. It's not just a spike for something like a massive car crash, it's consistent. We are in crisis." That's the staff and the union representations of Esther. This is on the 28th of September 21, and the response from the government at the time, silence. Absolutely nothing. On the 8th of October, the Federal Minister for Communications, Paul Fletcher, wrote to the Minister for Emergency Services, highlighting on the 6th of October alone, 2 calls were on hold for 30 minutes. 20 calls were on hold for between 20 and 30 minutes. 37 calls on hold for between 15 and 20 minutes. 53 calls on hold for between 10 and 15 minutes. And the response from the Minister? Silence. Still would not speak up about the crisis that was happening. There are so many stories here in Victoria about people dying on hold, and it is quite simply not good enough, and those families deserve an answer. But I'm going to read back to one of the articles that's come out recently because it deserves to be in Hansard, and the Minister must answer for this and the Premier. And it details the case of Alicia Hussein. It is when Alicia's face turns a bluish grey that her mother, Jasmine Hussein, realises the window is closing to keep her 14-year-old daughter alive. Every second is precious, every minute a lifetime. Breathe, Alicia. Please breathe. Jasmine has dialed 000 and is waiting to hear the voice of a call taker to tell her what to do or to get an ambulance on the road. Esther is meant to answer this call within 5 seconds. But on this night, October 27th, 2021, no one at Esther is picking up her call. 30 seconds tick over. 1 minute. A Telstra operator is still trying to page Jasmine through the 000 call taker, but it isn't working. Neither is the puffer or the nebuliser that normally helps Alicia during this asthma attack. Jasmine knows that a speedily dispatched ambulance can stabilise an asthma patient, but no one is picking up. And now Alicia is turning blue. Alicia is 14. Jasmine hears herself telling the Telstra operator her daughter might be dying. Alicia's face is not only drained of colour, her eyes have moved from pleading to panic and the terror as there is no air in her lungs. 2 minutes pass, and Jasmine decides to put her daughter onto the back seat of the family car and race to hospital. 3 minutes. Esther still hasn't picked up. Jasmine is performing CPR in the back seat while her husband drives. Her 000 call is still with Telstra and the operator is trying to page it through to Esther. The Telstra recording captures Jasmine speaking, this time just 2 words. She's dying. 5 minutes pass. Jasmine is trying to revive her daughter. She is screaming, "Breathe, Alicia, breathe." 10 minutes, 11 minutes. Ambulance still ringing out, says the Telstra operator. There is still no one at Esther who is able to pick up. 13 minutes have now passed, but Jasmine's call remains an urgent flashing light on a computer screen as call takers help others in the 000 queue. 14 minutes. Alicia's mum has given up on getting through to Esther and is carrying her into hospital. The unnamed Telstra operator has also given up, the recording capturing her muttering in frustration, 15 minutes. On a hospital gurney, the teenager is almost unrecognisable and surrounded by doctors and tubes. Long before she's formally declared dead, Jasmine knows the absence of life in her little girl's face is gone. Esther never picked up the phone. Never picked up the phone. If it was a one-off case, you would say it is an absolute tragedy. A little girl, 23 months old, November 3rd, 2021, dies in a drowning pool, multiple calls to 000. The family drives her to an urgent care centre and make 2 further calls where there is further delays of minutes trying to get through to Esther. A man, 43, November 10th, 2021, collapses, 2 calls to 000, about 4 minutes but doesn't connect. The man dies at the scene. A man, 49, November 18th, 2021, gets a limb injury in a chainsaw. Call takes 5 minutes and 36 seconds to connect. The man is conscious when paramedics arrive. He goes into cardiac arrest and he is declared dead on arrival at hospital. A little boy, just 2, on November 19, 2021, was face down in a public pool where he was for 10 minutes, and it takes 5 minutes and 44 seconds for 000 to connect. He is resuscitated on the scene but dies later in hospital. A man, 51, December 19, 2021. He has cardiac arrest at home and it takes 5 minutes and 22 seconds for the 000 call to be answered. He is pronounced dead at the scene. These are all supposed to be answered in 5 seconds, Speaker. January 5th, 2022, a man, 39, suffers from severe shortness of breath. It takes 6 minutes and 14 seconds for the call to reach an operator, followed by an ambulance dispatch delay of 14 minutes. The man goes into cardiac arrest soon after the paramedics arrive. Man, 21, January 6, 2022, goes into cardiac arrest at a public car wash. It takes 4 minutes and 26 seconds for the call to be connected. Dies at the scene and after 47 minutes of resuscitative efforts. Man, 61, January 14, 2022, collapses. His housemates hear him. It takes almost 9 minutes for the 000 call to get through to the operator. He dies at the scene following more than 30 minutes of attempts to save his life. Man, 51, January 15, 2022, goes into cardiac arrest after choking at a food court. It takes 4 minutes and 21 seconds for an Esther operator to be reached. The 51-year-old was pronounced dead at hospital. A baby, 9 months old, goes into cardiac arrest and the call was delayed for 4 minutes and 28 seconds. And the infant was later diagnosed with a large subdural hematoma and dies at hospital 2 minutes later. These are all cases that we are hearing in our offices, in the media, and I am confident that Labor members of Parliament are hearing exactly the same thing, and I'm yet to hear them stand up in this place and call it out that it needs to be fixed. What did the government do? What did the government do? The government sacked Marty Smith, said he resigned, on the 21st of October 2021. We all know how we work. That's the scapegoat to try and push it aside. He was lobbying the Andrews Labor government since the pandemic started for increased staff, and he was continuously ignored. That is simply not good enough. He was literally thrown under the bus and gone from Esther. Danny Hill from the Paramedics Union has come out and said, we're hearing of some very, very unwell patients waiting for up to 20 minutes to get through just to get a call answered. And I've given you the cases today where they've died. The member for Melton was the former involved with the Ambulance Union, Paramedic Union in Victoria, and I hope he's speaking on this MPI today. And I hope he's reading through those same statements that we're reading through, and I'd be very pleased if the member for Melton had the courage to refer to Danny Hill's comments about people dying in Victoria. It's not the ambulance or the paramedics, it's not the call operators, it's a failure to invest for so long from this government in our entire health services. Danny Hill also said, in relation to people waiting, that 2 minutes is dire. It is a matter of time. It is time which can be life or death. And when the government stand up today, and they will talk about their trumpeting of their $115 million investment, which will put Victorians on hold for another 15 months before they're going to fix this problem, so they say, a problem that they broke. Let's not forget, ambulance call takers were reduced during the pandemic. Not people on leave, not people on furlough. They were people that were no longer there or replaced and cut harshly during a pandemic by this government. There is 2.3 full-time equivalent less staff just at Ambulance Victoria. There is a 13% decline in call takers for fire and a 3.42% in relation to police here in Victoria. These aren't our figures. These aren't made-up figures. These are government figures. And all of this has led to people dying here in the state. And you add that to, we are the only state in Australia to have a code brown. Our waiting lists are so out of control, the minister couldn't answer what the number was here in Parliament today. Either he has no idea, or he, like the former Minister for Health back in prior to the 2010, wants to hide the figures. We can't forget that the Premier of this state was the Health Minister when they hid the elective surgery waiting lists. That is shameful. Shameful. And we're seeing people on hold for Esther. We're seeing delays in getting ambulances to them, and then we're seeing people for elective surgery denied that surgery. They've closed, during the pandemic, closing and stopping surgeries in the private health system for elective surgeries. Take out the word elective and replace it with vital, because you don't go in and get surgery for nothing. You go in there because it needs to be done. It's something that's urgent. It's the stories we've heard here again and again. And I'm going to say, it must be. I can't believe, of the 100,000 people on the waiting list, which averages more than 1,000 in every person in here's electorate. Every single person in here has more than 1,000 people on average in their electorate on the waiting list. And I can't believe that it's only Liberals that are getting emails. It just makes no sense, Speaker. It can't be that the only officers, and the Nats, and I apologise, and the Nationals, are probably, you know what, probably the Independents and the Greens as well. I reckon they're getting it. But it appears to be Labor is getting no emails. Is it true that areas like Cranbourne, Narre Warren South, Narre Warren North, Melton are not getting those emails? Are they not getting anyone coming through who needs to get a knee replacement, a hip replacement, pain control? The member for Hawthorn, I'm confident. Not one. I'll put that on record. Not one email from the member for Hawthorn. Now, that is crazy. The member for Footscray says not one. I find it amazing that it's only Liberals getting these emails. And I can't wait now. I'll be speaking to my good friend John Basciuto to make sure he sends that out to his electorate. But it is so important that you can't. I'm predicting the future, that it will be his electorate. I'll tell you now, you can't say that only Liberals get this. There's only one reason behind this, Speaker. Labor MPs are ignoring this problem. They are ignoring the fact that people are dying on hold. They are ignoring the fact that on 60 Minutes just this week, we watched as a mother spoke into that phone and said, "Breathe, Alicia, breathe." And I want every member of Parliament, I don't care what side you're on, to have that ingrained in your head. My wife in 1995 watched her brother pass away from an asthma attack whilst on hold. And they know you're going to turn around and go, that was in the Kennedy era. It hasn't changed. It hasn't been fixed since then. To watch that happen and hear of a mother going through that should send shivers down your spine. And don't get up and talk about the bragging and the patting on the back that the Premier wants to do today. Talk about what's happened in the last 8 years, the absolute failure to fix this system. Because I'm sorry to say, after these times, since that election in 2014, it's now your fault and it's now your problem. And the member from Melton's got his papers there, and I'm looking forward to hearing from him. And I hope that you quote every quote that Danny Hill has put out there, and I hope you have in your mind, breathe, Alicia, breathe. Because if you haven't got that in your mind, you're thinking about the wrong thing here today, and that's people's lives in Victoria.